Sleep apnea is a common disorder in which you have one or more pauses in breathing or shallow breaths while sleeping. Here are some of the symptoms and possible treatments to overcome this condition.
Sleep apnea is a common disease. First, maybe the Asian, maybe 1 every 5 has a disorder, so it is very common. It's usually caused by narrowing in the upper airway, in the throat. So the patient will start having snoring. The snoring is the sound, the air trying to go in and out the throat, which is narrowed. So that's why it gives a funny noise we hear. Then as we get older, the narrowing will get more severe, and the muscles will get flappier, so they get collapsible. Basically, air does not move to the lung for us to breathe because of severely narrowed throat. And then the patient starts to have all the symptoms. One of the most common symptoms of that is the daytime sleepiness. We do not need quantity of sleep only, we need to have the quality. So the quality will be disrupted because the brain has to sense everything. Even when we are sleeping, the brain has to sense that the air is moving to the lung. When the brain will notice that air is not moving because of this sleep apnea, then the brain has to wake up so we can breathe. Sleepy person, for any reason, especially when there is sleep apnea, is like a drunk driver, where they will have more car accidents. And that's the simplest way. 7 times more car accidents than normal population. That's because they are so sleepy and they cannot keep their eyes open, and they cannot react quickly to any events happen to them. Besides, sleep apnea will cause a lot of medical comorbidities. We know that during sleep, our temperature will go down, our blood pressure will go down, our heart rate will go down. Sleep apnea is a common disease. It is a deadly disease. It causes a lot of physical comorbidities, and it must be treated. Now, how we treat the disease is very simple. We have to keep the airway open. 90% of the patient will end having what we call a CPAP machine. A mask will be placed on the nose or nose and mouth, and blow air with pressure to open the throat from inside. And we titrate the pressure during the sleep test. So we will know that the airway is open, there is no snoring even. We finish even the snoring, and the patient will take the machine and he try to use it every night. Now, in some patients, we can do surgery when they cannot use a CPAP machine, especially when they started to have cardiac event because of the sleep apnea, when their heart started to dilate and they keep going to the hospital with decompensation of CHF, enlarged heart, then fluid gets accumulated inside their body, inside their legs, inside their lungs. So these patients, they will do a special surgery, we call it mandibular advancement surgery. There is nobody does it here in this country. They do it in America. Now they started doing it in Europe very recently. In Switzerland, there is a guy who started doing it, and they do it in Japan. It is a very delicate surgery. They will take the diminution of the throat and the airway by a computer and see where they need to advance the jaw to the front a little bit. They will cut the jaw, and it is a massive surgery. The other things we try to tell the patient to stay fit, to exercise. If somebody keep exercising, sleep apnea will decrease because the muscular tone will get stronger. Remember at the beginning, I told you as we get older, our muscles will get flappier. So patients at age of 25, he was a snorer. People used to be annoyed that he keeps snoring at home. But when he gets older, sleep apnea will happen because the muscles get weaker. So we tell them to do exercise because that will improve the muscular tone.